that you have been able to join us this afternoon for this webinar. We have some excellent speakers for the webinar today, and we're looking forward to having a good, rigorous conversation and discussion around going beyond collective impact, moving to community and systems change collaboration. Before we get started, I'm going to go over a few logistics of the webinar. If you are having any problems accessing the audio, just call 919-357-8990 and we will work through any technical difficulties you may be having. We will be recording this webinar, and after the webinar, the slides and the presentation and the audio will be posted to the CJA website. We are going to keep all lines muted throughout the webinar to cut down on some of the background noise that comes along with webinars, but you will be able to speak and ask questions, and you will be able to do that in two ways. If you like, you can simply type your question into the question box, and you will either get a response in that question box, or we will bring your question to the discussion. Or you can raise your hand. You should see a small little hand to the right side of your screen. If you push that, raise your hand, we will unmute your line. So we will be working very hard to have a nice open discussion. So we encourage you to take advantage of both the question box and raising your hand. Okay, so before we get to the content of today's webinar, I just want to quickly tell you a little bit about Communities Joined in Action. We are a national membership organization of local and regional community health collaboratives. And all of these collaboratives are working to mobilize and assist community health collaboratives to assure better health for all people at less cost. We support our members by facilitating the dissemination of innovations, health models, and we also provide peer-to-peer learning opportunities, including a webinar like today. We also have learning networks where we're connecting members to each other from across the country, and we hold a national conference about once a year. We are a membership organization, and we do depend on membership dues to keep CJA going. So I do encourage everyone to join CJA, become a member if you are not already a member. And you can go to our website, which is cjaonline.net, and join. And for all of you who are already a member, thank you. We really appreciate your membership and look forward to connecting with you throughout this next year and the webinar. Going to the next slide. One of the big events that CJA does hold is our national conference. And this is the save the date. We've just recently announced the next conference, which is going to be February 15th through the 17th in 2017, and it will be held in San Antonio, Texas, and promises to be a great conference. So mark it on your calendar and start talking to your friends and colleagues about attending that conference. Okay, so now we're going to move into the webinar content, and I am going to get it started by introducing the moderator for the webinar today. Kevin Barnett is a senior investigator for the Public Health Institute. He is also a CJA board member and has been a CJA member for quite a while. Kevin's primary focus of his research and fieldwork is on charitable obligations of nonprofit hospitals. He has a particular emphasis on institutional alignment and the strategic investment of charitable resources to improve health. And Kevin has been with CJA and has worked with many communities across the country, and will have much to share on this webinar today. So I am going to turn it over to Kevin to begin the discussion.
Thank you, Linda. Can you hear me?
Yes, I can.
Terrific, terrific. Well, good morning to those of you on the West Coast, and good afternoon to others as we move east. I am delighted to be with you today as a moderator with a couple colleagues with whom I have immense respect and who are taking us into, I think, the kind of critical discussion we need to at this important juncture in time with how we work together, bring about the kind of systems change that is needed, and to engage community stakeholders and community members in a deep and genuine way. As a way of taking us into that discussion, I'm going to start and set the tone with a brief introduction of the collective impact concept. CI was introduced in November 2011 in the Stanford Social Innovation Review. In that article, it was presented as a unique model with a core set of 5 conditions. There was a lot of attraction to this model and these conditions, in part because it was viewed as elegant, as a simple, straightforward way to do something that has really challenged practitioners and stakeholders for many decades. In essence, in some ways, is sort of presented as hermetically sealed, in a largely dispensing with a lot of the research and a lot of the documentation over many decades, the challenges, the lessons, real complexities associated with the kind of collaboration with diverse stakeholders that so many have documented. This elegance proved to be quite attractive to a host of players, not least the philanthropic community, but also a wide range of institutional stakeholders, which welcomed an approach that seemed to sort of float by a lot of that pesky complexity. I found myself actually drawn to the concept, particularly as it related to the notion of investment in a backbone entity, as they called it, having on so many occasions experienced the frustration of building deep, sustained engagement and working towards systemic systems change without resources for such an infrastructure. CI continues to be a compelling model to a huge number of people across the country. I just finished 2 days of meetings with colleagues here at the Centers for Disease Control and Prevention, and CI was referenced a number of times as a favored model, in some cases just as sort of a generic way in which we come together. So in that context, there has been a growing dialogue about what is it, what are we missing here? What are ways in which we need to approach the engagement? How do we really integrate the important learnings of the work, and at the same time really begin at this critical time move forward? For today's webinar, we're extremely fortunate to have the benefit of 2 national experts in the field of community engagement with many decades of experience on the ground, working in hundreds of communities, and I might say with the scars to show for it. Tom Wolf will get us started. Dr. Wolf is a community psychologist committed to the issues of social justice and building healthy communities through collaborative solutions. He is a nationally recognized consultant on coalition building and community development and has a lifetime of experience training and consulting with individuals, organizations, and communities across North America and around the globe. Tom has published numerous resources to help communities, the most recent being The Power of Collaborative Solutions, 6 Principles and Effective Tools for Building Communities, that was published by Josie Bass in early 2010. He presently runs Tom Wolf & Associates in Amherst, Massachusetts. His consulting and clients include federal, state, and local government agencies, foundations, hospitals, nonprofit organizations, professional associations, and grassroots groups. Our second panelist, Arthur Himmelman, is a national expert with a focus on community and systems change collaboration, over 40 years of experience working with communities from multiple vantage points as an advocate, an organizer, as a senior program officer in philanthropy, and as an inside-out change agent. He articulated a typology that caught my eye very early on in my work, looking at different forms of engagement in a monograph in 2002 called Collaboration for Change. And it is as relevant in today's environment as it was when he first developed it. Similar to Dr. Wolf, Arthur has a wide array of clients with whom he has worked with to advance this work. He is the principal for Himmelman Consulting, based in Minneapolis, Minnesota, and he welcomes the opportunity to travel to work with communities across the country, particularly between October and April. With that as an introduction, we're going to go back to a set of poll questions that we posed, and I'll ask my colleagues to put those up. So we asked folks participating your familiarity with collective impact. Is it very familiar, somewhat familiar, or not familiar? Next slide. So we heard from a little over half of you that you were somewhat familiar, and not surprisingly, a good proportion of you are very familiar with collective impact. Next question. In the run-up to this meeting, we shared an article that Dr. Wolf authored, a Nonprofit Quarterly, that really began to raise and address some of the questions around collective impact and how to move forward. We ask you if it raised questions for you. You could answer yes, no, or the dog ate my copy. And your responses. So for a little less than half of you, it raised questions, and a little more than half had their copy eaten by their dogs. I hate when that happens. But we hope that even if your dog did such a deed, that you will be actively participate in this. Our colleagues, our panelists will raise some of these issues, and I will emphasize that that this webinar is fundamentally committed to engagement of folks. So we're going to be looking for questions and comments from you in the course of this webinar. And then we asked you if you were part of a coalition. And in that coalition, did you have a leadership role, you participant, or do you not have a role in a coalition? And the responses? Well, not surprisingly, the vast majority of you are either in leadership or a participant in a coalition, and we welcome those who are not currently in a coalition role, getting your perspective as well. So that's sort of who we are, who will be engaging you, what the core topic is, and I'm going to turn it over now to Dr. Tom Wolf, who will set up our dialogue with some sharing of the content. Tom?
And I'm going to turn this upside down on you, sorry, Kevin, but Arthur wanted to start off with some general comments, and then I'll get to my presentation with the overheads.
Perfect, that's just fine. Arthur?
Good afternoon, everyone. It's a great pleasure to be part of this webinar and not only talk about some of these issues, but learn your perspectives as well. I'm just going to give a little context for what we call community-based collaboration. It has been around a long, long time. Certainly it's been around since the 1960s when there was a lot of community control and community engagement going on as people tried to move agendas for social justice and social change. And over the years, it became known by different names, sometimes public-private partnerships, community-based collaboration, multi-sector collaboration, and various other names. And in 2011, FSG, the consulting firm, branded it as Collective Impact, which many of us feel is just another form of community-based collaboration, essentially a new brand, not a new model. Some things that are important to keep in mind is that a lot of this community-based collaboration really resulted from what you might consider to be an abdication of public responsibility for basic human needs, particularly by the federal government. And in the 1980s and since that time, there's been a lot of effort to devolve the responsibility for a lot of these needs to local government, local communities, even communities and neighborhoods, where because of the complexity and difficulty in addressing these needs, it sort of engendered enormous numbers of so-called partnerships, community change efforts at local levels. Now, this sounds good in the sense that you were closer to the issues being addressed and you could probably make better decisions in many ways. But the problem with it all has been that at the local level, no matter how good your demonstration of change is, and there have been many, many examples of very important demonstrations of community change in various areas, none of it could go to scale. That is, you couldn't make it a systems change because you never had the resources or the power to do so. To compound this, there was an effort to privatize the public sector in many cases, to take government out of it. And also, it operated in what I call sort of an ideology of doing more with less. So that meant that no matter what you were trying to do, you always had to be thinking about how can we save some money, how can we be more cost effective, which on the surface sounds reasonable, except if you think about it, if you're operating within that context, you don't get to ask questions about why do we have fewer resources in the first place to work on these very, very important basic human needs. That becomes a political question. So in the context that's emerged, there's still a lot of activity going on all over the country at community levels. We're trying to engender beyond community what we call systems change, that is, community efforts that have reciprocal and reinforcing change in institutions and larger organizations, so that when you get to the level of policy, you've demonstrated how both communities and larger organizations can work together at systemic change. All of this is to say that the chances of doing this at a large scale remain slim, and remain particularly slim if we think that community-based collaboration in and of itself will produce the kinds of social change and social justice that we may seek in the larger sense. So that's kind of a large context. It's very quick and very brief. I'll be glad to talk about it further at some point during the webinar.
So, can you hear me? Are you turning it over to me?
Yes, Tom.
Okay, great. Hi, I'm delighted to be here. I'm sitting here in Western Massachusetts and glad to be talking to you all across the country. And I'm going to start by sort of going through the critiques that I made in the Nonprofit Quarterly article that you saw, that is actually just coming out this week and next in the hard copy, about Collective Impact, a short 6-page paper written by 2 consultants from the West Coast a couple of years ago, and adopted widely and wildly, very quickly by everybody. And they had observed a small number of coalitions. The article had no references to previous history, no sense of research. The most frightening part for me, as having done hundreds of coalitions and screwed up much along the way, was that they'd never done a coalition. They observed 6 identified successful coalitions and drew the principles, and it was then adopted by the federal government, state government, foundations, all the same people who demand from all of us in every application proof that what we're doing is evidence-based. And they were going without even from an article that wasn't even literature-based. So it made many of us who've been doing this work crazy for many years. And finally, I put this together with some help of colleagues. And I want to go through the pieces, and I'll ask Linda to move the slides forward as I go, because we'll go with that one. about 10 places where collective impact gets it wrong, and the new directions that we have to take based on that. The first thing that I noticed is that it does not address the essential requirement for meaningfully engages those in the community, and I use the term most affected by the issues. So think about the coalitions you're a part of, and think about who are the people most affected by the issues. And are they at the table? And if they're at the table, do they share the power with others at the table? And that's really the key question for us to discuss. I think, having done this with numerous communities, people were so frustrated trying to get the community to the table that they often have given up. And instead, we go for the usual suspects. If we are concerned about health disparities in the Latino Coalition, we get the head of the agency that serves the Latino Coalition to come to the table and represent that coalition. She may not even work in the community. She may live in a community outside, and but she becomes the designated usual suspect for talking about the Latino community. And when we try to reach out and bring the Latino Coalition to the table, community to the table, we often have a struggle. So I want to start by just opening up that as a question and saying, what's been your experience at bringing the residents, those most affected by the issue you're working on, whatever it is? And so first ask yourself, who is the issue? Who is the population most affected by this issue? Obesity, diabetes, traffic accidents, whatever the issue is, who's the population, and have you been able to bring them to the table? The secondary question will be, when they come to the table, what's their role? Do they have any power? Do they share decision making? So let's pause there and let you think about it. And this is where you raise your hand and log in, and we'll give you the microphone, and you speak, and then we'll respond to it. But as we said, as Kevin said, the request to Arthur and I was not to lecture to you for 2 hours. I've been on webinars where I'm lectured to for 2 hours, and I go and read my email, and I do other things. But to exchange with you and to hear what the issues are, and then give you answers and resources to deal with this question. So where are we? Anybody want to take a shot at it? I have patience. I know you got to struggle with this.
Tom, can you hear me?
Yes.
Tom, while we're waiting for a question, I have a first response from someone that indicated, to be honest, we have not brought a community member to the table yet. Krista Woolley, would you like to expand on that?
Hi there, this is Krista with a new coalition in Rowan County, North Carolina. We have not had the opportunity to bring a coalition or a community member to our table yet. Honestly, it's been a struggle just to get the organizations to the table due to a lot of just the conservative nature of the politics in the community. Now that there's been sort of a change in the county commissioners and change in leadership and some of the bigger organizations, we've finally been able to get just organizations to the table, and our next kind of step is reaching out to the community. I will say on the board for one of the organizations, we do have a community member that struggles to attend meetings due to transportation and just the time of the meetings and kind of those other barriers that we really didn't anticipate when we first invited her to be a part of the board.
Well, can I respond? Can you hear me?
Yes.
Yes.
Great. Great comment, Krista. And this is very common. First of all, we don't think about bringing the community to the table at the same time as we bring the heads of agencies. And the question is, why not? Who knows better about the issue? Who knows better how to solve the issue? Who's the person who could tell us, oh, yeah, I know you're going to do a health education program. We've had 12 agencies who've tried that. It never works in my neighborhood. The only person who can tell us that are the people who live in that neighborhood. And but we don't go there first. And then we encounter exactly what you said, which is, well, they can't make our meetings. We meet Thursday afternoon and noon. And they say this thing like they work then, or they have kids they have to cover then. What kind of an excuse is that? I'm not saying you say that, but we set it up. And so there are some rules that we could just think about. If we really wanted a community person to come to our table, and it may not be that they have to come to our table, maybe we'll go to their table. But if we want them at our table, what are some of the basic things we have to do? And you named them. We have to provide transportation. We have to provide childcare. We have to feed them if it's around a meal, or feed them and their kids if it's around a meal. If they don't speak English, we have to provide translators or interpreters. And since everybody else at the table is getting a salary for being there, we got to provide them with a stipend, at which point many coalitions will scream, we can't pay them. That's not right. They're from the community. They should just volunteer to do this. But we know exactly what their lives are like. And if we don't, well, we'll learn it this way, which is their lives are harried with 2 jobs and kids and both parents working or only one parent home. And there's no way that our asking them to come to a meeting in the middle of the day is going to work. And then we sort of put the blame on them, as opposed to saying, we've got to modify the way we do it. Now, when you say, let's meet Thursday evening at 7, then all your agency people are going to say, I don't do evening meetings. And so the question is, how do we find a compromise? But I would suggest, having done this for so many years with so many communities, even though I love you all, I don't believe we can trust ourselves to make the judgments about what a community needs without talking to them and having them at the table to help us decide. Krista, does that make sense to you?
Oh, yes, absolutely. Those are some really great points.
And we have some techniques, proven public health techniques that'll get people to the table. You can do little mini grants and put a small amount of money out for your topic and see what community groups come forward to do whatever you're asking in the mini grant, but also a requirement of the mini grant is that they sit at the table with you. You can do leadership development. You can train the community members in leadership so they feel comfortable sitting at the table with us. When we bring people to the table and we go around and introduce ourselves, and we're so pleased we got Linda, our new community resident, to sit there, and I go around and I say, I'm Dr. Tom Wolf from Tom Wolf and Associates, which I never do, but let's say I do, and we get to Linda. What does Linda say? I'm just Linda, which is universal, and it says, write me off, because this environment doesn't make me feel legitimate. And so part of what we have to do is we have to train the professionals at the table to act differently so that when the residents come, they're welcome as equal participants. Arthur, you
Tom,
may
I'd
add
like
to
to
that?
jump in.
Yeah,
Yes, I would, Tom. Thank you very much. Many years ago, one of the projects I worked with was out of the National Cancer Society, and they were trying to do something about cancer control and prevention by doing a lot of work around the country in various regional seminars, workshops, etc. And they had that same question. We have this very important work, but it's very, very hard to get people to come to the table, as Tom and you've talked about. It is hard, but I did tell them, and Tom already mentioned, this is very important. Well, before you do that, why don't you spend some time at their table, in their communities, in their settings, and actually establish relationships with people so that they feel they have a connectedness to the work, and they also know that it's probably going to be reciprocal, that you care about what they're concerned about. You may be concerned about a health issue. They may be concerned about a safety issue or another issue. Now, it's time-consuming and labor-intensive to some degree, but going to the tables of others is very important. The other point I'd like to make is that we do have to get into the question of how we know things. Professionals like to know things that are scientifically valid, best practices, verified, et cetera, et cetera. But when you work with community, neighborhoods, and constituencies who have not had a voice, they also have a lot of knowledge, by the way. They have different ways of knowing. And I think it's very important for professionals to realize that there are different ways of knowing, cultural ways, ways from people's experience that should be as legitimate, at least to listen to, as you work through some of these problems that you want to address.
Yeah, John McKnight used to say, the people in the system love numbers, but the people in the community love stories as a way of verifying our information. Can we get another slide, or do we have another comment from the audience?
Yes, we do. Yes, we do. I wanted to share. Melissa Baker noted that they have made the effort and have some success in different places, but identify that there are a number of barriers. So, Melissa, I'm wondering if you would like to take a moment and share with us a little bit of the successes you've had and or barriers that were not identified. Can we connect, Melissa?
Okay, so we've unmuted Melissa, but I'm not sure if she is able to participate.
Okay, I just see that I'm unmuted. Can you hear me?
Yes, we can.
Yes.
Okay. We have been trying for some time to engage community members and realize the barriers of time and the discomfort of inviting people to our group, our table full of professionals. There's one initiative called that we're doing here called Community Centered Health Home that's really gone out into two lower income communities and started out not with a particular agenda other than to build trust, and that's been going on for about a year now, six to 8 months at least. And in those communities, there are a couple of there's a small group of community participants, group leaders, that have come to a couple of our meetings recently, which is exciting. But that's taken 6 to 8 months to cultivate 2 or 3 people who have shown up. So just to say, we're trying really hard to be cognizant of some of those barriers, and we're thinking now of some more creative ways to really cultivate a group in community that could be some kind of, we're just beginning to talk about this, but could be maybe some kind of community-based advisory board or advisory group that we would cultivate and train and build a long-term relationship with, and that could be kind of that community resident group that might shed input and produce initiatives along several different grants or initiatives or agencies who are looking for that kind of community input.
Beautiful.
I respond to that briefly. I think that's wonderful. I think you're doing something that is so fundamental, that is building trust, and we all understand why people might not have a high level of trust with people from professions and institutions. One thing that Tom and I and our colleagues have been very interested in terms of getting beyond collective impact, is the sort of the basic need for community organizing to exist among stakeholder groups, neighborhoods, communities. That is, someone that spends their time really building the relationships, organizing people, setting tables, and actually does it on the behalf of the stakeholders as opposed to the institutions and organizations that are the partners. And what you'll find is almost a complete and utter flaw with all these initiatives, pretty much, that there's no community organizing function that is available to the residents. And so I would suggest that you consider, not that I'm trying to scold anybody because everybody runs into this problem, but maybe there's a way to support some community organizing so that you don't have to do so much, that the people themselves get organized with someone that they trust to bring them and bring you to the table. That's just a suggestion.
Good idea. Let me just pick up on the other thing that Melissa said, which was it's taken such a long time to get this far. If we were getting the police chief to join, a coalition on violence, and it took that long, we wouldn't think anything of it. We would just sort of say, yeah, it takes that long sometimes to build trust with the police chief. Somehow we think it should go easier with the residents, But as we're experiencing painfully when we look at the stories of police and communities of color, our relationship with communities is not super good. And there's a long history of distrust, a long history of being misused, they feel. And so getting as far as you got took that much time. It's a blessing that you got that far. And it's your determination and your ability to be flexible and your sense that I'm going to put in the energy to make this happen. And it's happening. And I think we just have to assume there's no easy bullet to get this done. And I think that, of course, was some of the mistakes with collective impact. Everybody thought, oh, this is going to be fast and it's not going to be messy. Bringing a community to a table is always messy. And so I think what you're doing is great. Do we have more questions? Otherwise, we can go to the next slide, which is related to this.
Yeah,
Let me just say, go through this quickly, and then maybe Arthur will comment as well. This was developed many, many years ago, 20, 30 years ago by Sherry Aronson, and it's the degrees, the ladder of participation. So when we decide we're going to bring somebody to the table, and the coalition says, yes, let's get those grassroots people there, let's decide what we're going to do with them once we get here. Very often, all we want to do, manipulation, decoration, tokenism. We want to say, you see, we heard you. And so our coalition on youth and drugs has Johnny here. And Johnny is the head of the student council at the high school, and he's the first person from our high school who's ever been accepted to Harvard, and he's going to represent the kids who are dropping out on drugs. Aren't we glad to have Harry here? And we do this all the time in terms of not really thinking about who we're bringing to the table and what are we going to do with them. The second thing we do with them is assigned roles or consulted and informed. We get them to the table, we say to them, okay, tell us what the issues are in your community. Why is it that there's so much obesity? Why is it that there's so much heart disease? And they give us the whole story. We write it all down and we say, thank you very much, we'll take it from here. And then we come up with our own solutions that of course won't work because we didn't consult with the community. So we really need, the only reason to bring people to the table is if we're willing to share decision making. And I get a little less fussy in the top three categories because I see so little of it that about which one of those three you do. You know, a lot of people would prefer, and I would prefer, that it be community initiated. But I'm happy if it's agency initiated as long as we get the real people to the table who are most affected and we share the decision making power with them. And so, yeah, but you have to get your coalition ready for that. Because if they come to the table expecting what we've always done with these folks, which is, you know, decoration, tokenism, assigned roles, they're going to just cut these people off at their knees, and they're going to feel burnt one more time, and we're not going to learn anything more. So you can look at this degree of involvement, and before your coalition invites anybody, say, what do we want to do with them? And see if people are really ready for the shared decision making. Does that make sense to folks? Does that raise issues for anybody? Anybody ever try it?
Folks, love to get any questions or comments on this. While we're waiting, I want to pose a question myself, Tom and Arthur, on this issue. So, you know, it's having folks in a decision-making role is critical. My own observations in many of these kinds of efforts is that we don't think enough about the fact that that folks have a direct stake in this process and immense direct contributions. So not only can and should they have a role in determining the appropriate direction, but that we often overlook the fact that they can make immense contributions to this, particularly if we get out of the service mentality.
Absolutely.
Can you comment on that?
Oh, could I jump in? Do you have if I have a
Sure.
minute, second here?
Yeah.
It's important to, maybe important to note that the ladder of participation was developed in 1969.
Yeah.
Predating the magic of collective impact. So we've known about these things for a great many years, and we've struggled with how to do it. My own work has two models, betterment and empowerment, which means that from the very beginning, you can design a partnership or a collaboration to increase or limit in the first place. You can always, and I think it's important to increase in decision-making authority and power by decision-making. Or now that's a little different, but you could.
I really work with bringing young people to the table. A training manual for the adults sitting at a table with you and allow them to be equal partners, because we've turned to the young people and say, you know, when I was a teenager, and that's a sure way to shun. Well, they gave the African American and Hispanic kids some, and when the adults started to carry on, they flipped the slide over. Oh, I'm so glad you brought Harry to 472. And you've got the map. So that's why a lot of
Tom and Arthur, I had one of our participants who was asked around collective impact. I'm wondering if you there in the collective impact model are these issues.
The answer to them nowhere. They do have a one that essentially says collective impact is a way together to make decisions for a private consultant. For someone is, how can you pay these fees? I mean, we're asking people to now move towards a social change model, an empowering of the community model, and we're asking a private for-profit consulting firm to be the leaders on that. I think that's not going to happen. So they don't preach this. They now are tacking it on because there's so much criticism of it. But when you've got a top-down model where the CEOs of all the organizations are at the table, and now you say, oh, and now we're going to add the grassroots and they're going to have equal power, you know, the other people who come to the table understand it's too late. The territory has already been split up, the power has been distributed, and now I'm a guest at this table. So I don't know how that's going to happen, but they don't address it at all in the original 6-page article. Now all the things that come on now sort of say, oh yes, we've got to have the grassroots there, but they don't say how. And I have at the end of this slideshow the address of the community toolbox, which is I hope you all know it, but if not, it's a 7,000-page free downloadable website, ctb.ku.edu, that'll tell you exactly how to engage those in the community. So the tools are there, and Collective Impact offers none of them. I don't know if that answers the question.
It does. It does. And
there's one other.
Yeah.
There's another way of thinking about it real quickly. I think we're all familiar with the concept of blue ribbon commissions. And also, if you've worked with United Ways, for example, you'll know that there's a leadership group, and then there's a workers group, etc. So some of the model has come out of very sort of traditional. Tom calls it top-down. I think they do too in some ways. People who are decision makers, important people, but they leave out the people that are closest to the issues and probably know more about them. So this has been done for a long time, and it's just a new version of something like a blue ribbon commission.
Terrific.
I did a webinar in engaging the community and coalitions for MCH federally, and I'll give the link to that to Kevin and company to send on to folks after the webinar.
Thank you, Tom. And for those that haven't had the pleasure to meet Tom in person, he has a substantial beard, which for the first part of your comments, Tom, I believe your beard was rubbing the screen.
Oh, I'm sorry. I'll keep moving it away from the mic. Thank you. That's good to know. I can't hear it.
Yeah, thanks.
I'll keep moving it away. If it happens
Okay,
again, tell me. Move it away.
Okay.
And Kevin, can you hear me? This is Linda.
Yes.
I believe that Leslie Graham has raised her hand. Would like to make a comment?
Oh, terrific. Uh-huh.
Yeah.
Okay,
Hi.
Leslie, go ahead.
Hi, thanks. Leslie Graham. I'm from
Welcome.
Montgomery County, Maryland. Hi. And we're working on a regional partnership for population health here, involving the hospitals and the communities. And I really was intrigued with your comment on your example of sort of the high school valedictorian off to Harvard who's representing the high schoolers who drop out. So I recently had a similar experience. One of the programs that we're working on is Medicare seniors living in subsidized independent senior living housing, and sort of their experiences and care coordination, bringing that all services together for them. And so we have two wonderful individuals who represent the senior living facilities, and we were getting a lot of input from them, and our focus of the program, really the funding, was for Medicare seniors, and suddenly I learned that neither of these two happened to be Medicare recipients. So it was sort of like, oh, you make assumptions about people. But as I was thinking through your example of the high schooler, you know, how it's very hard for one person to be representative of a group.
Right on.
Clearly defining that group. You know, so because people identify with so many different, how do we really define the group that we want to have identified so we can find the best representative from that group?
Take my quote. Likely are focusing on those people who are struggling, who are falling through the cracks in terms of making it, in terms of services and housing. So you want to find some people like that. And then when you find them, you say, oh, let's get them to come on Thursdays at noon. And you think, not a chance. We're not, you know, wheelchair accessible or whatever it is. And so then you have to go to what Arthur said. You got to go to them. You know, I worked once in a neighborhood, it was a neighborhood health, community center that was there to organize the community, set up 40 years ago, and it had evolved into a typical service organization. And we had a retreat with the board that said, we don't want to be doing this. We really want to be strengthening the community. And the thing we decided to do was small Hispanic neighborhood. What's not so great about this neighborhood? What would you be willing to work on with us to find a solution? And it was a radical shift for this organization to go out and to ask questions. And you should be able to find enough resources to send someone out. They don't have to go on to every door, but to talk to a range of that's an idea. The closest thing I can think of to get what we have these people who are non-medical, who they know ask, are all talking about these people, but they don't have them in the room. How can they possibly know what's going on? So I think we have to take the time to go.
I think it's a learning experience as we, I mean, my point is that it's a learning experience as we go along. We
Absolutely.
can ask ourselves who is most affected by this, but when we are the ones who are not affected by it, we don't sometimes know, and we learn as we go along. Oh, we thought it was all people who live in subsidized senior living facilities,
Right.
but now it's this, or,
Yep.
and it turns out that it's actually, now we've been getting more into it, hardest to reach. We go out and think, okay, now we're getting to the people who are most impacted, or the hardest to reach, or the ones we're really not hearing from. We unveil another layer that says, oh, actually, we can reach that layer, but they're not representative of this next layer. So it's really, we have to keep asking ourselves that question.
Absolutely. And if you're on the journey you're describing, you're succeeding. Most people stop when they're stymied in the big community who can help me get into that community. And so we know we have solutions for that, but you're right on target. Exactly. It's a path.
Yeah. Okay.
Great. Please continue, Tom.
Okay, so let's go to the next slide. This was one of our next critiques.
A quick
Sure.
that one. I just want to make sure that we reinforce our sure what by many English. Example.
Is that goal consulting approach. And so Kanya and Kramer are business consultants. That's what they've done. That's what FSG does. And so a community development approach is really a bottom-up strategy. And my question would be, how does your collaborative do that? I think in some ways we've already covered that, because I really loved what some of the last speakers said. You try it. When you get stymied, you hit barriers, you just keep going, and you find out what's the next barrier, and you keep going. And it's really an incredibly interesting adventure to try to figure out, well, who really is struggling with this, and what's it like to talk to them? And when you get to talk with the Russians, to understand some of what is in their culture that makes it hard for them to do some of what you would hope they would do to overcome the barriers and to join you in your solutions. And it allows you to identify partners in those communities who become the ambassadors, the links, the health outreach workers to those communities. I don't know if anybody else, this item is so similar to what we just talked about. Do other people have other comments on it? But a community development approach is not what we're generally trained in, but it is the description of going and knocking on doors. It's the description of solve the
Organization.
where we just have the link to each other. We need to have them talk to each other. Keep agendas. Where the self-interest is from these, then we know a little bit, maybe what you were referring to. I think works in the community. I mean, we make, and they can tell us who are the people to talk to, who will link us to those most affected. And if we want to change a norm in a community, we're useless at changing norms in other people's communities. We could preach at them, give them brochures, but the norms get changed when they themselves adopt it. And that's been the power of peer educators in high schools, that you have a peer who's now saying, maybe this isn't the best idea to try those opiates, as opposed to don't do opiates brochure from the adults, And so I think there's a lot that we can learn, and there's an incredible role those people can have. And we have to invite them, saying, the reason I want you to be here is because you bring all this to the table, as opposed to, we just need a token student, we need a token elder. You're the people who understand what's going on. That's why I need you.
That's a great point.
Could I jump in on that?
Please, I was going to ask you to.
Yeah. So another way of thinking about it is, the CEOs don't have to be there all that much, because they're not going to come to every community initiative in their entire town, right? They're going to have some delegation. And so they're people, organizational resources to the CEO or director is to support. So people show up something, and that's something that top leadership have to engender.
Great.
About starting from the collective impact offering, so the often people at the table resources that is being sought, and that I believe Arthur is directing. Can you address talking community members in the
There's a lot of obsessing about, does this person have the authority of the organization? I think a lot of that's irrelevant if we don't have the community there, because we've just got people who are not connected to the community talking to each other and inventing solutions for people who they don't know. So we can worry about it, but I don't, because I've got a much bigger worry. Now, once we have the community at the table, this is what Arthur is getting at, do we have the capacity and the commitment of these organizations to do something? If the community says, what I really need, I'm coming in here with a teen pregnancy grant, and I want to know, how do we help teen pregnancy in your community? And they say to me, I need the streetlights fixed. We're not going to talk to you until the streetlights are fixed. No, 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 you didn't understand. I got a teen pregnancy grant. And they say, fix the streetlights. And so you got to say, hey, does anybody know anybody at DPW? Yeah. Get those streetlights fixed so we can deliver something to these people. And actually, let's set up a meeting with them and the DPW so they can say, fix our lights, and then the lights get fixed and they feel empowered. Great. That's what I need them for, as opposed to saying, well, let's see if I can find $1.75 in my budget to replace the light bulbs. I need them to flex their muscle and get the DPW.
Yeah, thank you.
I just want to add a little bit to that too. This business about bringing organizational resources is so fundamental. If you administrator decides some judgment has engendered employed, and they're monitoring, et cetera, et cetera. So if you had the same approach to community change, you would deploy people with access to various resources, but you'd also be willing to learn from that deployment how you would change what you're doing internally to be better at what you're doing. And so part of the reason you want those resources is that they can also produce change in the institutions as well as the community, reciprocity. And I think Collective Impact is aware of that. I think they talk about that to some degree. But you need that kind of commitment to change, as well as the broad commitment for resources. Once in most cases, in the approach community change.
Healthcare, and it was an HIV prevention coalition of racial justice in HIV, since it's now a concern of communities of color. And they developed a beautiful internal mission statement that the goal of this is to reduce HIV infection in men having sex with men in a certain neighborhood in Boston, and that it's going to be done from a racial justice lens that looks at our own internal institutional racism, our white privilege, our white supremacy. Yeah. The roof blew off in almost all those agencies. If you'd said to them, oh, could you say that you're going to address HIV prevention in the LGBT community with people of color? Oh, yes. But if you identify racism and all the other pieces of it, they were going crazy. I don't know. I want you to be part of that coalition anymore, etc.
Yeah, great point. Would you like to continue, Tom?
Sure, let's and collective impact. CDC goal of bringing communities together to change transforming existing power relationships. So that's what this is all about. And everybody endorses it, loves it. Yes, we want to see policy change, until you think about, what does that mean? And so the question really is, has this come up in your coalitions? And if so, have you had a conversation about serious you are about doing policy and policy, looking at the policy changes, and here are some of the policy health that we have to call them about because they're making it really hard. And so we'd say to everybody, okay, you're going to call them and this is the message. And then after a couple of months, I asked people, well, how many people called? And they all looked like, oh, the dog ate my homework. And it turned out almost none of them had. And I said, well, how many of you have ever called your state legislator? And almost none of them had. So if we say we are going to look to create policy change, and we don't have the basics of policy change, which is we have to have a relationship with the legislature, we have to be comfortable calling them, we have to have some permission from our agency to do legislative work, etc., then this is kind of nice, fancy talk, but there's no meat to it. So I wonder whether this issue of policy
I'd like to share your experiences in this. Again, we're talking both public policy, efforts around public policy, as well as institutional policies.
Right, right. You know, on domestic violence, it can be we want to change the state law around domestic violence, or we may want to change how so you guys, any issue you do food, and then machines with soda in it, all that. Small p policy. Right. Not dealing with it, the barriers are. I promise not to bark. I was trained as a psychotherapist, so I'm very good at sitting quietly and waiting for a response.
Too funny, Tom.
Ready
What's
when
your
you
billable hour? What do you charge for that?
I gave that up.
So we have a comment from Carrie Reingens. Carrie, can we plug her in?
Thank you, Carrie.
I'm not sure if you can hear me.
I can hear you.
Oh, fantastic. Okay, this is a new set of earphones. Many of our coalition members come to us with issues that are policy level issues, and then they would like to address them to, untangle some things to make their work on the ground, their direct service a lot easier. But they are concerned that they can't do that kind of work because it looks like they would be lobbying. So, for example, one thing that's been a big issue here in Michigan is that some of our mental health services, the benefit designs of some of our Medicaid health plans don't necessarily cover as much treatment as many of our community members might need. And then once they max that treatment out, they're supposed to be eligible for state public mental health services. Well, there's a limit to how much service our state public mental health service can provide because they have a limited budget, so they're not able to provide that additional care. So when our members want to do some advocacy at the state level, they're concerned that they'll look like they're lobbying, and as nonprofits, they're not allowed to lobby. So that's one of the biggest concerns that we have for some of our members with trying to do some systems level, policy level work.
Well, you just said the magic sentence, as nonprofits, we're not allowed to lobby. And unless I don't know the laws of Michigan, but certainly everywhere else I know, you are absolutely allowed to lobby. You're absolutely allowed to take 10% of your budget and commit it to the lobbying process. There's been a huge amount of propaganda to shut up the nonprofit sector and the health sector by saying it's illegal for you to lobby. And there's no saying that if you do lobbying, someone's not going to throw that at you. But you can check the laws, and the best way to do that is just go to your statewide advocacy groups, because they're going to know them well, because they're lobbying all the time on these issues. But I quite clearly believe that that this is absolutely there as a law. Just go online and Google nonprofits and lobbying, and you'll see all kinds of national organizations that lay out the rules. It is amazing how many people believe you can't. Now, am I wrong about something in Michigan that I don't know? I mean, I know you have a horrible governor who would make this hard, but that's not law.
I'm not going to comment on the governor, but
no, I didn't ask you to.
I will say
that was my comment.
Even if we are allowed to do up to 10% of our budget to dedicate to lobbying activities, it might compromise our view as being objective. And even if it's issue-based lobbying, not, endorsing candidates lobbying, it could still reduce our credibility in the community.
Well, let me address that. First of all, you're not allowed to do candidate lobbying. I think that's illegal everywhere. So it is about issue lobbying, and you will be discredited everywhere. Well, that may be true. There may be the legislators who don't want to deal with this issue who will discredit you. But the population who you're addressing and the other folks who you want to mobilize around this issue will not discredit you. They'll say, thank goodness that someone is raising this issue. And so I've always felt that I needed to partner with the statewide advocacy groups who learn the ropes and know how to do this in Massachusetts. And there's some wonderful resources. Arthur can mention one of them. The one that I like a lot, you can get free online, is called Real Clout by Judy Meredith and Kathy Dunham, that describes how you can do lobbying. It's based on a Massachusetts model, but it's good for everybody. And you'd have to modify some of the specifics for your state. But I think we have to learn how to do this. And we have to give ourselves permission, and we have to support each other, and we have to get the statewide groups to join in that process so that we can move it forward. It is really in the best interests of the state. Our lobbying is not to do in the state. Our lobbying is to make sure that the clientele and the people we're serving and the people of the state are doing the best they can on health issues. And in order to do that, we know policy is determining so much of it. Look at what happened around smoking. We were able to eliminate smoking in many ways by having policies at multiple levels. It was a intentional, systemic approach to lobbying that had statewide lobbying resources. So I don't know if that helps.
Tom, I'd like to see if we can bring in another participant, Greg Borum, sure, who's noted that they do quite a bit of public policy advocacy at the local and state level.
Great.
And he comments that they still see a lot of organizations that are uncomfortable with it. Greg, can you join us?
Sure. Can you hear me?
I bet.
Okay. Yeah. Hi, Greg Borum in Asheville, North Carolina, and our organization several years back really recommitted ourselves to doing public policy advocacy on a wide range of issues, and we have kind of developed some training resources that came out of those conversations, and have now been able to train other nonprofits and make them a little more comfortable with developing kind of the infrastructure for raising their voice and feeling comfortable with the laws around lobbying and what the do's and don'ts are, and really dispelling that myth that they can't lobby. We've been fortunate that a regional nonprofit support organization here in Western North Carolina has worked with us now to make this available to the entire region through some regional trainings. And we've seen a lot of organizations get interested in it as the kind of global climate, political climate continues to strip resources. And I think that what you talked about at the beginning of the webinar about this larger lens of government divesting and these needs are having to be dealt with at the local level, that more and more nonprofits are beginning to see that they might need to get back into the game of discussing issues and funding because the resources have just been drying up.
Outstanding, Greg, and I would hope that you can share that resource with the other folks on the line, and I would love to see it as well, because this is an issue that comes up again and again. And you're right, it is an issue that makes people uncomfortable, but it's not illegal, and there's a big difference there.
Yeah, and just quickly on that, one of the things that we try to work with is really basing the advocacy that you do back to the values that your organization stands for, and getting people away from feeling like they have to be issues experts and reminding them that they're values experts, and that's where they can engage from.
Terrific.
I'd also like to suggest that this may sound a little draconian, but the devolution and the push to local levels around changing policy was intentional so that policies would be harder to change. So this is not an accident, but I think it's very, very important to realize the whole nonprofit sector was set up to limit the ability of government to make policy in terms of these areas. So what Tom is talking about is very important to know that there is room within nonprofit sector organizations to do a lot of this work, and Tom has mentioned I have some other resources. People are very knowledgeable, and just as you were saying, how to do this without having a problem with their nonprofit status. But let me just put it this way: if you do not do policy change, then what you're basically doing with the other work you're doing is helping it get worse more slowly.
There we go. I'm aware of the time, and maybe we could take just a few minutes for me to go through the slides so people know what the resources are on there, and then open it up for whatever questions get raised by the next 6 or 7 slides. Would that make sense?
Yeah,
okay.
Thank you.
So let's move forward. The next thing that we talk about is there was no references in Kania and Kramer's work, and we need to build our successful models on existing research and practice literature from a large range of fields. When I started doing coalition building work 40 years ago, I was finding resources in people who were doing community communication and public policy and public health and community psychology, which is my field. They came from everywhere. And if you go to the toolbox, and now you have the address there, you can see that. And one of the things we know, go to the next slide, is that there's been research on what makes coalitions effective, as opposed to 2 consultants who do OD, organizational development consulting, look at 4 successful coalitions and say these are the principles. Fawcett and Rousset reviewed all the literature on outcome studies in 2001, and that was a long time ago. But then, when they looked at it, they saw those that created community change. That was the definition. Now again, everything that you're seeing from Kania and Kramer is what they're guessing is the outcome. Clear vision and mission, action planning, developing and supporting leadership, and this is where I really challenge the idea of a backbone organization, which is the paid leadership as opposed to a function of developing leadership. Documenting, getting feedback, getting help when you need it, securing the basic financial resources, and most important, making outcomes matter. We're all at the table here, not just to produce a grant and some numbers for the grant agency that gave us the money, but to change the community. And then from another set of data that was working with the substance use coalitions, we found out that those coalitions that labeled conflict, they didn't have to solve it, but labeled it, also were more successful in reducing substance abuse. So we have a lot of coalitions made up a lot of human service people. As they described to me in northern Minnesota, we're Minnesota nice. We don't do conflict. So you can't have coalitions where there are conflicting issues where we can't at least label it. So we know something from the research about what works. And there's much more data than just this, but this is a nice summary. So we need to look at that material well. keep going, and I'll get through this quickly. Next. We have to address issues of social justice. That's at the core of this. If we ask our community about what is the root cause of the health disparities in our community around any issue, we're going to get to start to talk about social justice and racial justice and institutional and structural racism. And so if we ask the right question, that will emerge. We don't like to explicitly talk about racism. That's now become a national discussion. But when I worked in Boston with the Boston Public Health Commission, and Barbara Farrar was the commissioner, she's now at Kellogg, she had a brochure. They were focusing on REACH grants, which were racial equity grants from the CDC, for breast and cervical cancer. And her brochure said, if you're a black woman in Boston with breast or cervical cancer, racism is part of the issue. That freaked out every white person, white agency in Boston, but the black women came to the coalition because I said, you know what? Someone understands what we're going through. And they didn't mean that you were dealing with racist people. It meant that being a black woman and experiencing racism your whole life is taking a lot of toll on your health. So again, that's a critical piece. Social justice. Are you doing it in your coalition? There's no reference to that in Collective Impact. Now they're saying, oh yes, we're tacking equity on. But even in a brilliant piece by Angela Glover Blackwell about equity as the soul of Collective Impact, it's essentially just an incredible critique of Collective Impact for not dealing with this. Next slide. I'm going to just quickly go through this and you can collect your questions. It mislabels this a study. This is not research. And I would always want to say, what can we learn from our failures? Because that's where I've learned about coalitions. And by the way, okay, we'll keep going. Next slide. It assumes that all coalitions are capable of having a well-funded backbone organizations. And I totally love the backbone organization because when I ran coalitions, I couldn't get the funders to give us 2 cents for a centralized facilitator for the coalition. So sure. This, they all wanted to give you the next money for your next program, but they didn't want to support your survival. So I appreciate that, but then they go overboard. And by now you're talking about small coalitions. They need $100,000 to do all these functions. And so I see the function of the facilitating organization to build the strengths of the coalition, to run the coalition, and to build the leaders for the next function. Next slide. We can't do this in 5 simplified steps. And I remember once a guy named Bill Potopchik, who I have great respect for as a coalition consultant, 20 years ago, he drew a circle with the stages of coalitions. He said, this is what people preach are the stages of coalition. But in my experience, every time I go into a coalition, they start at a different place. So this isn't a step-by-step thing. And the way they put forth the Collective Impact, it sounded like you follow these 5 principles and you're going to be all set, no problem. And that's why all the funders fell for it. They said, oh, I've been looking for a simple solution to these complex issues, and it doesn't work that way. And I think the next slide, is my book, in which I talk about the principles that I've used and tell the stories and the tools. And so you can go to that. You can also go to my website where many of this stuff, if you don't want to spend the money on the book, you'll find much of that same material available in pieces there.
Terrific.
Keep going on this. I think keep going with the slides and we'll be opening up for questions. These are the principles that are in the book. Keep going. There's no research on Collective Impact that shows that it's working. As a matter of fact, the earliest research is calling it into question as to whether it's providing coalition effectiveness. And outcomes are the critical outcome we're talking about here. And finally, I've been working with a group of people who are trying and are writing a piece about what has to come next after Collective Impact. And our proposal is that it be collaborating for equity and justice on the following principles. And those principles are very much what we've been talking about. So we have a few minutes left, and I like just to stop and sort of say, what does this leave it with other than confusion? And hopefully some good resources.
Thank you, Tom and Arthur. Any final questions or comments? Observations? We're getting a lot of thanks to you two for your great insights.
Well, let me just say I really appreciate the work that people are doing. It's damn hard. It's not easy. No one, they sort of lay it out as if this should be simple, bring people to the table and plan it all out. I really appreciate the people who described the process and the barriers they hit and how they then keep going, because that's what this is all about. And as I said, McKnight's stuff about stories, I love telling the stories because they make it real. And that's been my experience doing it, and I loved your stories because it makes it real. If you want to get the community to the table, it's going to be a journey. And I love people describing that journey, and maybe through the work you're doing with this organization, you can support each other on that path. So thank you.
Great. Again, this is Kevin Barnett. I want to thank Tom Wolf and Arthur Himmelman for an extremely stimulating both presentation, but mostly stimulating discussion with our colleagues that are out working in their respective coalitions. I'm going to ask Linda Kinney to take us out.
Okay, great. Well, thank you so much, Kevin and Tom and Arthur. It was an excellent webinar. And thanks to everybody who joined the webinar today and participated. And thank you for the work you're doing in the community. As Tom said, it's really hard work. It takes time. It takes a lot of honesty. So we really appreciate you doing the work that you do every day. Great. So we are finished for the day. Do look for a link for an evaluation of this webinar. We are always looking to improve webinars, so please fill that out and give us feedback on that. We are also interested in any other topics that you might like to see through CJA. We will be doing more webinars throughout the year, so watch for that. And also make sure you've marked your calendars for the CJA National Conference, which is going to be February 15th through the 17th in San Antonio, Texas in 2017. Okay, so with that, we will sign off. And thanks again to everybody. Really appreciate your time.
Thank you, everybody. Good luck in your work.
Bye, everyone.